This segment is sponsored by Virginia Family Dentistry.
We're back for a visit to Virginia Family Dentistry, talking with Dr. Melanie Spears about orthodontics and really creating a beautiful smile, which orthodontics is part of that, Dr. Spears, but it's not the whole piece of the puzzle.
No, it's definitely not the whole piece of the puzzle. I think, having a healthy smile is really how we create a beautiful smile. And so for me, it's all about creating a healthy bite and also just making sure that the teeth are healthy as well as beautiful at the same time.
Let's talk a little bit more about that, because for most folks, they think of braces when they hear orthodontics, but it's a little bit more, it's broader than that. Correcting a bite is a big part of that.
Yes, and it's not just braces now. Gosh, we have so many options. We do have clear braces, but we also have Invisalign and other clear options that are really opening the world of orthodontics to a lot of people of all ages. Making sure the teeth are straight, but then also functioning properly, because when the teeth function properly, they can be healthy, and we are trying to prevent things like cracked teeth in the future. Also making sure that jaws are functioning properly.
I hadn't considered that. You have so much pressure in your mouth when you're biting and chewing that if they were misaligned, you really could be doing some damage.
Oh, absolutely. Yeah, we see people that have not had orthodontic treatment that have very deep bites. If they say we see them in their 30s for the first time, we see very short teeth in the front from where they've just had so much pressure on their teeth for so long. Also, people, you may have heard of cracked teeth in the back. There are people will crack whole cusps of their teeth off and need crowns and potentially lose teeth because of poor function. I mean, the muscles in the jaw, especially with some people, can be very, very strong.
Well, again, too, thinking about having braces, and obviously the picture is broader than that, you think about having this work done when you're young, and that's not the case either. You're seeing more and more adults as well.
Oh, yeah, I'm seeing a lot of adults. It is nice if we can get to somebody at a young age, because there are things that we can prevent. The Orthodontic Association recommends 7 years old for a screening visit. Now, we're not treating everybody at that age, and in fact, I think a lot of parents are nervous about coming in at that age, because I think they think we just want to put braces on everybody. But we recommend 7 years old in order to just prevent things like there can be problems with teeth coming in the wrong positions that we may not need to even treat with orthodontics, but we may recommend a primary tooth or a baby tooth come out a little bit early to help a tooth come in the proper position. So that it's about prevention, and there are things like people can be growing in poor directions, and if we just make some small movements and corrections in the beginning, they can really normalize their growth and development, and that's important for jaw function.
And that's exciting to learn. I didn't realize that you have that meeting with an orthodontist above and beyond maybe your regular family dentist at a certain age, and around that age of 7 that you mentioned for kids, and they'll come in, and in a practice like Virginia Family Dentistry, you're all here. It's multifaceted, so it's a great way to have everything under one roof.
Oh, yeah. That's probably the thing I'm most excited about being in this practice, is just that we are all under one roof. It's almost like the benefit of a university type setting where, in a university we had all specialties in different areas, and we were able to collaborate. But without the bureaucracy of the university setting, we are all here under one house. And every day we're back and forth talking about patients' treatment, and it's actually really, really neat. And we're able to give each other, or give patients a more comprehensive treatment options.
A great way, too, to consult with each other and weigh in. One of the thoughts that we hear often these days are about like mail order, alignments and that sort of thing. There's a difference in coming into an orthodontic practice.
Oh, a big difference. That's actually a really big concern for orthodontists now. They're, I would say, direct-to-consumer type programs that they're marketing now. There's a lot of careful planning that goes into where somebody's teeth should be positioned. And it's a biologic process, tooth movement is. And so when the teeth are moved improperly, you can actually cause some irreversible damage that could really cause some tooth loss, things like that could be a real problem.
Yeah, so certainly seeking out the experts, getting started around age 7 for that initial consultation for children, but adults can come in at any time.
Oh, yeah. Adults, there's really no ideal age for orthodontic treatment. of course, when you're a little bit younger, things move a little better. So, and there are things that would be beneficial about coming in early to prevent more severe things. But however, I have 70, 80-year-olds patients that are in treatment. Their teeth still move, and they're happy, especially if they've put it off their whole life, that, they're not covering their smile anymore, or, closed lip pictures and things like that.
Mm-hmm. A lifelong beautiful smile. Virginia Family Dentistry. Dr. Melanie Spears, thanks so much for talking with us. Appreciate it.
Thanks for having us.
Virginia Family Dentistry is located at 2601 Swift Run Road in Chester. If you'd like some more information, you can give them a call, 804-414-2250, or visit them online at vadentist.com.